everybody, Dr. Tyler Southwell here with Alpha Therapeutics coming at you again. Today I want to talk about autoimmune disease that causes pain. We're talking about lupus, psoriasis, rheumatoid arthritis. There are more. One of the things that happens when you get these disorders is that progressively over time you generally trend into a life of chronic pain. And chronic pain leads to medications. The medications we use in medicine that I was taught in residency to employ in situations like this generally have a side effect list that's as long as your arm. If there's a natural solution, most people are interested to know what that is and maybe give it a try. And in my clinical experience using Alpha Therapeutics, it's one of the first things I go to. I'd rather have my patients try CBD for their pain than opiates as a first step. I'd rather have my patients try CBD than Advil or Aleve or any of the non-steroidal anti-inflammatory drugs, all of which can cause problems like increased risk of heart attack, kidney disease, liver dysfunction. So how that works is Alpha Therapeutics, for someone with an autoimmune disease, let's say that's affecting their joints, which is most common source of chronic pain in autoimmune disease, we use a combination of oral systemic treatment and topical directed treatment. The way the topical works, our balm is made with the highest concentration of full spectrum product and that we could make, and we've used extensive study on patients and myself included to get to that formulation. It works very well. You apply it to the area that hurts, and you try to apply it like if it's an elbow, you put it on the elbow, but then you go up from the elbow where the nerves that feed the elbow go, because CBD is anti-inflammatory, but it blocks some of the pain nerve transmission. If it's your knee, do the whole knee and come up above the knee a little bit. If it's your spine that's hurting, then try to get directly over the area that hurts, and if it radiates down a leg, for example, go down in that distribution pattern. If you have pain in your spine and sciatica, you know what I'm talking about. If it hurts all the way to your foot, rub the topical all the way to your foot. You should get results within 20 to 30 minutes of relief. The systemic treatment is with an oral tincture. The way that we dose it, 1 ml equals 100 milligrams. 0.5 ml is 50 milligrams. That's important because you want to figure out what dose works for you, and it should be the lowest effective dose. How you define effective? It should last at least 4 to 6 hours. If it gives you relief in 30 minutes, but it only lasts for a couple hours, it's going to not be a very cost-effective treatment, although it still will be one of the safest you could choose. So in that case, increase your dose. If you started with 100, go to 150, which is 1.5 mLs. If it does work, then I would recommend the next time you dose, try half the dose. See if it also has that duration for you. And if it does, then that's your dose. Your bottle of tincture is going to last you twice as long. Some people need literally 1/8 of a milliliter. So try to figure out your lowest effective dose. Now, when you take the tincture, I want you to put it under your tongue. I want you to hold it there. I want you to swish it around your mouth so that the medicine can absorb through your under your tongue, sublingual, but also through your cheeks. When it does that, it gets around the first pass metabolism of the liver, so you can get more duration effect out of it. The liver is what clears CBD. And so when you can't stand it anymore, don't spit it out, swallow it, because the rest of it's still going to be effective. It's going to continue to absorb. I hope this is helpful. I hope it gets some of you off of medications that you don't want to be on. Thank you.